All right, so this is Dr. Amanda Witt. It's our lecture on concussions. This is a hot topic socially and also something that has historically been underdiagnosed and underappreciated. So we'll take a few minutes going through some key points for concussions. Again, I'm a physical medicine and rehab doc, and so I see these in adults and children. So we're going to go over the criteria for diagnosis of a concussion, go through some common symptoms, work through a couple of cases to highlight what you can do, well, really one case to highlight how you can manage a patient and when to return them to play. So our patient for this presentation is a 16-year-old. He comes to your family practice clinic Monday morning. He was in the Friday night football game and had a helmet-to-helmet collision during play. He says he didn't lose consciousness. He thankfully was appropriately managed. He was sidelined. He was not returned to play, and his parents took him to the ER after they heard that he still had a headache and had vomited times twice. He also, it just seemed off. So the workup at the ER was fairly unremarkable. The CT head was normal. So he was discharged home with precautions and no return to play, obviously. And over the weekend, he still kept a pretty persistent headache, 6 out of 10. It's pretty significant and debilitating, and he slept much of the time. So does this patient have a concussion? So go through what you think. On the slide, give it a little pause, and we'll talk about it. So this patient did have a concussion. Why? Well, he had a normal image of his head. Concussions have normal imaging. If you have an abnormal CT head or MRI head, you actually have a moderate to severe brain injury. Concussions are mild traumatic brain injuries. So that's actually a diagnostic criteria. Your imaging is normal. He didn't lose consciousness, but he did have multiple concussion symptoms, including nausea, confusion, and headache, and additional sleepiness. Concussions either can cause you not to be able to sleep or cause you to sleep a lot. So that is definitely a positive finding. Another way to pull out from this patient a full understanding of what happened to his brain is to ask him what he remembers before the hit and after the hit. And that gives you an idea of what kind of memory loss, like pre and post amnesia, that we are dealing with. That is prognostic. For how he's going to do, how long he may have symptoms, and how severe his symptoms may be, the longer that time period is. So fact 1, you can have a concussion without loss of consciousness. That is definitely a thing. Fact 2, concussions or mild brain injuries have normal brain imaging. So we'll call our patient John. When you ask him what he remembers, he tells you that he remembers his classes Friday afternoon at school, but he really doesn't remember eating dinner before the game or being on the field at all. He does remember being in the ER sometime during the time he was there for assessment. His concussion occurred in the second quarter, and so he had a pretty significant block of amnesia that sounds like it happened for over probably 3 or 4 hours. He hadn't vomited anymore, but he has the headache, like we said. He has a dizziness and feels off balance. And the dizziness can be lying down or sitting up. He obviously has not been back to school. This is Monday morning. He's groggy and sleepy. He just hadn't wanted to eat much, which is unusual for him. 16-year-old football player not wanting to eat much, that's unusual. He hasn't had any previous concussions, and parents concur. At baseline, he's a good student, A's and B's, and he likes basketball and football. He, on exam, did have trouble with attention. So things like digit span, serial sevens, took quite a bit of a struggle to get through. When we talked about comparisons, we're looking at if they can go to an abstract thought or they stay pretty concrete. Like, how is a bicycle like an airplane? An abstract response would be, well, they're both forms of transportation. They both take you places. A concrete answer would be they both have wheels, for example. If you say, well, how is a hamburger like a pizza? If you say, well, they both have meat, or they're both round, that's pretty concrete. But if you say they're both types of food, or they're both food I like, then that would be abstract. He also has trouble listing items in 1 minute. This is a really good test for concussion and any kind of brain injury. Give them a minute, list everything you can see in a grocery store. Everybody's been in a grocery store, it's common knowledge, and we're just looking at that ability to have spontaneous thought in words and to be able to organize your thoughts and have spontaneous speech. If I see anything abnormal, I will see comparisons and listing abnormal in a concussion. He also needed some prompting to remember those 3 objects we do, right? 3 apple, table, penny, red balloon, Cadillac. I'm going to ask you again in 5 minutes. He really didn't get any of them spontaneously, and so what you need to do is pick words that you can find clues for. Okay, so like red. Okay, well, one of them is a color. And if they can't get it with just a category prompt like that, you can say, okay, was it yellow, blue, red? Try not to say things like, is it yellow, blue, or red? Because that gives them a verbal cue. Even if that's not your word, it's a little tilted. So try to keep your voice even for those. He also has some balance issues with Romberg, and he can't do single leg balance. So, first of all, we got to help this kid. We got to keep him safe, and we got to keep him from getting injured again, and we got to help him with the symptoms that he's got, okay? So the first thing to know is that there is no talk of a return to play until the symptoms have completely resolved. This will typically at least be 7 to 10 days because that's how long nerve damage tends to recover even the mildest ones, okay? If you want a full list of symptoms, which I thought was a little tedious for us, go to either of these sites. I think the second one, the first one has all the symptoms. It's a checklist. You can print it, put it in a folder, have it for when you're working. The CDC will always have this, okay? They also have some videos and stories from concussion patients, which might be helpful. These guys have more trouble sometimes than we think. Even though most will recover within a month, we cannot take these issues lightly, and I've had patients never recover. So, respect. All right, so he has a headache. We've got to handle this. If it was a mild nagging headache, we might want to just let him use some ibuprofen, Tylenol, maybe give him a little riboflavin and let it play out. But this is impacting his function and it is severe. And so I would go ahead and be aggressive with the treatment. One thing to know additionally, if you need to treat or not, is if they have a family history. If they already have a family history or personal history of headache and they're having headaches, then you need to treat. At his age, I like to start with Elavil, which is amitriptyline, at bedtime. It's a really good first-line preventative. You can, if they don't want a prescription medication, you can do things, preparations, or like a magnesium or riboflavin supplement for prevention. Some different formulations have them combined, like Migraleaf, or Butterbur actually has it too. So something to help him prevent his headaches. You can kind of feel them out to see where they want to start. I would start him on Elavil preferentially. And then if he has a headache that breaks through, I would tell him to take 2 Tylenol, like 2 500 milligram Tylenol. He's probably a big kid. 2 ibuprofen and a Coke. Taking the acetaminophen and the NSAID plus something with caffeine and sugar is a really nice combo. Excedrin migraine basically does this. The second thing is let him sleep. Don't wake him up. Don't let him be awake more. If he's sleeping that much, he needs to sleep that much. Keep him, limit that screen time. I wouldn't do any more than 15 minutes, if that. And as long as he's having a headache, no screen time. Appetite. This has just been a couple of days. Let him eat when he feels like eating. Let him sleep when he feels like sleeping. Time is going to be a great tincture at this point. Vestibular impairment. This can be a problem. Even a few days later, he's having dizziness and balance issues. Physical therapy. There are certain physical therapists that train for vestibular therapy, and this is the perfect case for that. It can help him resolve his symptoms much more quickly and thoroughly than just letting it alone. We have an excellent one in the pavilion. So now, what about school and football? So we know we can't return to play right now, so we already talked about that. But he's not in any shape right now for school. He really needs to get over this excessive sleepiness, and we need to get those headaches back down a little bit. I would give it at least 1 week. If he's still having symptoms, the family can call. We can extend it to 2. I would then see him in clinic in 2 weeks to check him out again. In the meantime, this is going to be a significant thing. you really have to grab teachers' attention. You cannot ever say they have a concussion. You're telling them the truth. He has a traumatic brain injury, which he does. It's mild, but you don't have to tell him it's mild. You have to grab their attention because this child needs to be attended to in the classroom. He may need additional time. He may need to sit at the front of the class so he doesn't get distracted. He may need pre-printed notes for a little bit because it's going to be really hard for his healing brain to listen, write, and keep up with a teacher. So just a few little adjustments can really make his transition to school more effective and any disruption in grades to be at a minimum. So I will do that pretty early, and if he doesn't need it, then there's no problem. But if he needs it and you don't do it, he may come in with failing grades before you can get things turned around and get the teacher's attention. Right now, I wouldn't even have him exercise. He doesn't need to be out walking. He doesn't need to be out jogging. He doesn't need to be weightlifting because any exercise is going to pull oxygen from the brain, and the brain needs all it can get right now to heal. If they don't recover after 1 month, it is called post-concussion syndrome. Most of them will recover within a month. With this type of injury, helmet to helmet, with that much amnesia around the event, he's not going to be one of those. So let's jump ahead 2 months, okay? So after a couple of weeks, he was able to go to the classroom. The teachers were cooperative with support, which is hit or miss, but we're going to give him the benefit of the doubt in our hypothetical case. By that time, he was still having some headaches, but they were mild, and it wasn't more than once or twice a week. He did have more fatigue, so the day wore him out more than normal, but he wasn't having to sleep all the time, and he was doing great with PT with his balance. His grades did slip, so he wound up getting some C's on tests for a little while. But by 8 weeks, he has turned that around. His grades are back to baseline. He's not needing to use any of the support that was temporarily put in place. He's not on the Elevil anymore, and he's not on the Elevil and not having headaches, so that's critical. He is back to his normal sleeping pattern. He doesn't feel fatigued by the end of the day, and PT has said he's fine from his vestibular issues. Appetite's fine, and he can't wait to play football in 2 days. They have a big game. It's a big district game on Friday, and this is Wednesday. Can he go back and play? So, first of all, he's cleared from his concussion. He is back to his complete baseline, including academic baseline, which is critical. You cannot be slipping on your grades and having headaches a couple times a week and go back to play, because you're going to wind up with a permanent concussion or potentially death, and we'll talk about that in a minute. Is it rare? Yes. But do you want to take a chance on a 16-year-old kid? In your responsibility? Heavens no. So, he can go back to play, but we don't just jump back into play. We have a kid that's been out of play for 8 weeks. He's also had an injury that has affected his response time, his attention, and his balance. We want him to get back into it on an appropriate scale, or we're going to send him right back in to have another concussion. That's another reason to wait. So, what we do is we start. So the first day, he can walk for exercise. Do it like 30 minutes, do a mile or something. If he doesn't have any dizziness, headache, etc., then the next day he can move on. What if he gets a headache? Then the next day, he walks again, and he does that until the headaches are not there anymore, okay? And that's with each of these stages. The second day, you can run and do more aggressive cardiovascular. No symptoms. The next day, you can go back to practice for sport-specific drills. This does not include contact. On the fourth day, again, symptom-free, he can return to a full practice, including contact. And then on the fifth day, he can go to full gameplay. And this allows him time to build up. We're stepwising it to make sure no symptoms are creeping up with milder exercise before we really put him into a position where he could have another concussion. Because we don't want his risk of concussion when he goes back to be any greater than it ever would be, right? We don't want him to be a littlest bit off. The other thing we don't want is for him to get injured while he's still healing. If you have a healing brain and you get out and you hit it again, your compensation metabolically, edema-wise, function-wise could be maxed out, and another head could push it to the point where you can have rapid swelling in the brain and die on the field. That is called second impact syndrome. That is something we cannot ever have. So that is why I'm very strict with brain injuries. Also, symptoms can go away, but the concussion doesn't go away. So you now have a blemish. You have a place on the brain that is not normal. It doesn't go back to normal. It compensates. You can work around it. You can work through it to where you don't notice it, but it's still there. And so when you have a second concussion, your symptoms aren't the same. They aren't going to be less than the first concussion. They're going to multiply because now you're building on a pre-morbid injury that you can unmask and worsen. And maybe you don't get back this time. You never really know with concussions if you're going to be able to get back or how much compensation that you're going to be working on. So I have a really strong conversation with family and patients at this juncture. Yes, you can go back, but listen to this, okay? I'll tell them about the concussions. They never quite go back. If they are to get 3 concussions ever, they are out of contact sports for good. And so if football is your dream and your passion and you want to play it, that's fine. But what you need to think about is how many activities you do that can cause a concussion. What if you get a concussion on an ATV and that knocks you out of football? Is it worth it to you to be on the ATV especially one without a helmet, right? Maybe your compensation is you make sure you ride a helmet and you don't visit trampoline parks anymore. Maybe you don't ride on the back of somebody's truck. And maybe you don't drink and drive. Like, we need to really have a severe risk management strategy here. If they don't want to do football, I would limit the other risky activities to really focus on it because they're one down. Like I said, fact number 5, 3 strikes and you're out. Neurosurgery and I agree on this one. If you have 3 known documented concussions or reported concussions, then you are out of contact sports. If you have any abnormal finding on an MRI or a CT scan, which puts you in a moderate to severe TBI, you don't go back to contact sports right then. And this really is to protect their brain. You have a few years to play high school sports. You might play college sports and then you're done. But you use your brain forever. So it sounds pretty harsh maybe, but you only get one brain. You get too many injuries in your toast. Talk to any NFL football player who's retired. Many of them wind up with ALS, or they die of suicide, or they wind up in prison because they abuse their wife, or they have dementia. Even Brett Favre down in Hattiesburg says he's not letting his kids play football if they don't improve the safety in it because he's only in his early 40s and has too many memory problems. So it's very real. Chronic traumatic encephalopathy is very real. And how many hits does it take to get there? We don't know. Does it take even enough of a hit to cause symptoms? No. Any hit can get there. That's why we're limiting headers. That's why we're limiting impact play with football. It's not to be mean. It's not because we hate sports. I love sports. I'm a big fan. But I also, am responsible for the children who come in my clinic. And if they walk off that football field and don't go back, but they can be an engineer or go to medical school or do whatever, run their small business and be married and have children and not be abusive or suicidal or forgetful or inappropriate, then I've done my job. If they can go back to football safely, I've also done my job. So we do have to be very appropriate. But children are impulsive. They don't see the long-term results. Sometimes parents don't see the long-term results, and you have to remember that. Even if it means you're the bad guy sometimes. I already mentioned second impact syndrome. That is very real. And it's very rare. But we have to remember that these brains, after a hit, are so fragile and so likely to have a second one because of all the impairments that come up. So the more you understand that and explain, the better it is. If they're going to go to somebody else, and I've had a kid who had multiple injuries. One of them was drunk driving, and he said, well, I can just go to somebody else. I don't care if I leave in a wheelchair. That's their decision. They can go to the local doc who's a big football fan and get released on the field, but it's not on my license and it's not on my conscience. I did my best to protect him from himself and from his mother, because she was right with him. So concussions can be very challenging. The nice thing is most of them do fine, and they can go back, and most of them won't return to your office with another concussion. But if I can keep one kid from coming in my traumatic brain injury unit with permanent deficits that we can't ever reverse, then it's worth it. It's worth being a little bit hard on the ones, because our brain's worth it.